lot of topics I want to talk about in this channel, and one of them that I'm excited to do is gestational diabetes. In this video, I'm going to dive in what it is, why some women get it and some don't, things you can do to lower your chances of getting it, what and when does a doctor order the test during pregnancy, what happens to the baby when you have it, and what are the treatments available once you are diagnosed with it. Wow, this is going to be a loaded subject, but I'll try my best to simplify it so all of you can understand it fully and make the necessary changes to lessen your risk of getting it. Welcome to Mother Baby Central, your resource for transformational information about pregnancy, postpartum, newborn care, and baby's first year of life. What is gestational diabetes? Simply put, it is a type of diabetes developed during pregnancy, as the name implies. The pregnant body does not produce enough insulin to regulate the blood sugar, resulting in hyperglycemia or high blood sugar levels. The only way to diagnose or find out if you have gestational diabetes is when the doctor orders a test called glucose challenge test. And this test is done between 24 and 28 weeks of gestation. There's no special preparation for the test. Just do your usual, go to the doctor's office, they'll let you drink a bottle of water containing glucose, and then an hour later, you will proceed to the lab to have your blood drawn. The normal value is equal to or less than 140 milligram per DL. So if it is at 140 and below, you do not have gestational diabetes. But let's just say the result is 141 milligram per DL or greater. What happens next? The OB doctor will order another test called oral glucose tolerance test or OGTT. This time you will be advised to not eat anything after midnight, no food or water. And then when you arrive at the doctor's office in the morning, the phlebotomist draws a fasting serum glucose, and they'll let you drink again a bottle of water containing 100 grams of glucose. Wait for an hour and then draw blood every hour for 3 consecutive times. The result will be discussed by your doctor, but let me briefly say what the normal values are, okay? If any of these two values are either equal or above, the doctor will diagnose you for gestational diabetes. For fasting, it's 98, 1 hour, the result is 180, 2 hour, 155, and 3 hour, 140. Normally, a woman who has gestational diabetes does not manifest any symptoms. That's why the only way to know is to go through the testing. But there are factors we can identify if you are at risk for it. So let's dive in. Number 1 is obesity or being overweight. Number 2, if you belong to a certain race, like if you're an African American, Asian American, mostly Southeast Asian, American Indian, Hispanic, and or Pacific Islander. Number 3, genetics, family history of diabetes of any type, if mom, dad, brother, sister has it. Number 4, prior diagnosis of gestational diabetes if this is not your first pregnancy. Number 5, you have pre-diabetes before even getting pregnant. Your PCP usually informs you that if you go to your annual check. And number 6, you have polycystic ovarian syndrome. All right, have you checked any of the boxes? If yes, let's proceed. If you don't have any of these risk factors, let's still proceed. Maybe you can share this valuable information to anyone you know who is at risk for gestational diabetes. By the way, the best way for this video to reach the person who needs it most is by clicking the like and the share button. Moving on, if you're diagnosed with gestational diabetes, what will you expect the treatment to be? The very first thing is, as with any other condition, is to know what the goal is. The ultimate goal is maintaining a good blood glucose level. You will need your own blood glucose meter, some glucose strips, and some lancets so you can check your blood sugar as often as 4 times a day per doctor's order. The treatment starts by following a healthy meal plan and increasing physical activity. Saying diet and exercise is such a cliche that I feel like when I say those words, the information just goes over your head, or worse, you will stop watching this video. Kidding aside, if it's your first time being diagnosed with gestational diabetes, you probably don't know where to start. Like what food to eat, how much, and how often. Don't worry, your doctor and other members of the healthcare team will guide you on your meal planning and starting some physical activity. You will be advised to exercise like 30 minutes each day, at least 5 times a week. If exercising is already a part of your routine, probably discuss with a doctor like what exercise is safe while you're pregnant. If the blood sugar is not controlled mainly with diet and exercise, the doctor will add a medicine called metformin. And if it's still not controlled, the doctor will put you on insulin. The insulin is an injectable medication you will self-administer, which goes to the fatty part of your body, or it's a subcutaneous injection. All these will be taught and explained to you in the doctor's office, so don't worry. The last thing I want to touch on is, how does this affect your fetus? If you have gestational diabetes, you could have a big baby. Therefore, your chances of having a C-section is higher. The baby can also be born prematurely, which can cause respiratory distress or problems with breathing, hypoglycemia, or babies with low blood sugar, and a higher chance of the baby developing type 2 diabetes in the future. To give you an idea of what to expect after you deliver your baby, the neonatologist will order a blood glucose check on your baby every 3 hours before feeding. The protocol changes with each facility, but normally it is done for the first 12 hours only, assuming that all the glucose levels are normal. The blood glucose checks can be extended if there are abnormal results or episodes of hypoglycemia. What are you going to do to lower your chances of getting gestational diabetes? Let's look back at the risk factors again. Well, you cannot change your genes, you cannot change your race, you cannot reverse your PCOS if you already have it, and you cannot change the fact that you had gestational diabetes in your previous pregnancy. There is only one possible solution left: the obesity factor. Maintain an ideal weight. If you are overweight or obese, make a plan to lose extra pounds. Obesity can bring a lot of chronic conditions, not only diabetes. Therefore, for overall health, it is vital to have a good BMI. How? Eat a balanced and healthy meal and increase your physical activity. Make it a goal to take care of yourself. Small steps in the beginning can do wonders. Do not overwhelm yourself and do fad diets and extreme exercise. Most of the time, these don't work. Partner with your healthcare provider and make an actionable plan to hit your goal weight. Alright, I hope you find value in our video for the day. If you do, please click on the subscribe button. Be well everyone, and happy watching!